Dr. Sarah Swall from Resilience RX, and today we are going to talk about how dry needling can be useful for sciatica. So before we get into that a little bit, I want to go back to sciatica in and of itself. So true sciatica is when it starts from the back and goes all the way down the leg. There's another thing called pseudo sciatica where people call it the piriformis, but the piriformis actually gets a bad rap. It's a lot of the other muscles in that area, like the glute medius and the glute minimus, that can actually have trigger points that mimic sciatica all the way down to the leg. It's pretty common in older women between 40 and 60 years old, especially those who like to run. So this is actually my mother-in-law, and she is letting me dry needle her. A little bit of background. She started running, got a lot of pain outside of the hip. Felt like sciatica pain, but actually weakness in those muscles that causes symptoms down the leg that feels very much like sciatica. So, for obvious reasons, we're not needling the glute muscles today, but we are going to needle the low back. Normally we combine the low back with the glutes, with the areas of the spine that innervate those muscles. So lumbar disc 4, lumbar disc 5, and then the sacrum 1, so L4, L5, S1, innervate those glute muscles. So we normally needle those, we pair it with the glute muscles, and then we do some E-stim. So today we will be needling lower back. So I have everything all prepped and sanitized beforehand. So we will go ahead and needle L4 and L5. This will be L4 on the right side, back and forth. These muscles don't really twitch a lot of the time when you put a needle in. Sometimes, at least not a visible twitch. I can usually feel it with my fingers. In this case, she's doing pretty good now. A lot of her symptoms have gone away, so I didn't feel anything on that one, which means the tissue is in pretty good state. This one's a little bit more, not a whole lot. So what we would do then is we'd needle those glute muscles that sit right kind of in through here. We'd pair the E-stim and we'd stim there, but for obvious reasons, we're not doing that. We're just gonna E-stim the muscles that are in here. So I'm gonna turn the intensity up slowly. Let me know when you start to feel it, okay? And so with this, you may actually, mild or moderate? Mild. Okay, let me know when it's moderate. Moderate. Okay, and so with this, you can actually see those needles moving and the muscle contracting. This simply helps reset that muscle. The dry needle itself reacts with that trigger point in there, causes that trigger point to fully contract and then relax, and then we get the relaxed muscle then to contract and relax in that fully relaxed state to help reset it. Kind of similar to when you're having phone issues or computer issues, right? You can restart the computer or the phone and oftentimes the issue just magically goes away. So it's kind of similar to the hitting that restart button. So I'm going to go ahead and decrease the intensity. Depending on the injury, we'll leave it on for different amounts of times. But one thing that can be a really helpful diagnostic issue is in determining whether you have true sciatica that comes from the back or sciatica that's actually coming from your glute muscles is how it feels going down your leg. So if you can draw your symptoms down your leg with a pen, like a super thin line straight from the back all the way down, that's much more likely sciatica. If those symptoms resemble more like a highlighter, so it's not pinpoint, but you can feel it going down, it's fairly local, but it's maybe a little fuzzy, not like pinpoint sharp, then it's more likely that your symptoms are coming from your glutes, and the glutes are one of the muscles in the body that respond really, really well to dry needling. So hope you all have a wonderful night.